As we start to go deeper in our understanding of Ayurveda, it's really important to understand, how does Ayurveda define health and how does Ayurveda define disease? So this is something that I think is really intrinsic to every medical system, is what is our perception of this, and how do we define health and disease? So there's a number of different terms for health in Ayurveda. One of the terms, Sanskrit terms, is called sukha, which means healthy space. And so health is defined as any place in which we can say there's a healthy space, versus the opposite, dukkha, is a space in which there is no ease, there is discomfort, there might be pain. So dukkha is a very popular word for pain and for suffering. And so Ayurveda looks at the most simplest definition is that health is where there is a feeling of peace, and disease is where there is suffering. And that's a very simple way to look at it. But all of the Ayurvedic goals to create health and to establish health are, how do we create this feeling of inner peace? That's really fundamentally at the core of our healing journey. So another Ayurvedic term for health is swastha. Swastha means established in the self. And so this idea of being established in the self means there's a certain mental harmony, mental equipoise that we are working to create this balance. So Ayurveda goes into a lot of depth of exploring these ideas of health and disease. And one thing that's really important is the understanding of the 3 doshas, or the Ayurvedic body types. We're going to go into detail with that in another video, so I'm not going to say too much about that right now. But in essence, when we understand these 3 doshas, Vata, Pitta, and Kapha, and we understand that each person's body type fits into one of these categories, then we can also start to look at disease prevention from this perspective. So a Vata person, we would say, has a predilection towards Vata illnesses. A Pitta person has a tendency towards Pitta illnesses. I know I haven't given you a lot of context yet to understand what that means, but bear with me. So this is just kind of to plant that seed of this idea in your mind, where we can start to use this idea of the body types as a form of diagnosis, as a form of prevention, and as a form of treatment. So in Ayurveda, as we're trying to create health, I'm going to read to you a little passage, a Sanskrit verse on the concept of a healthy individual and what this means. So I'm going to read the English translation of this verse, and it says, "The person being established in the self, who has balanced doshas, the governing principles of physiology, balanced Agni, which means healthy appetite and digestion and metabolism, properly formed dhatus, or tissues, the proper elimination of malas, or waste, proper functioning kriyas, or bodily processes, and whose mana, mind, atman, soul, and indriya, senses, are full of bliss, is known as a healthy person." So you can see there's so many components that go into defining this concept of health, that it's not just something that is the body or the mind. It's all of these things coming together. And it doesn't mean just a person who is symptom-free or disease-free. That final piece of that definition of a healthy individual was that that person is also filled with a sense of bliss. They have a sense of joy in their life. So we could be symptom-free, not have any ailments, and be miserable, and that would not be someone who would meet this Ayurvedic criteria for really defining optimal health in a person. And so this is an important thing that I recommend as clinicians, is for us to talk to our patients about, do they have a sense of joy in their life? Is this a question they've ever been asked by their doctor before? Is this something that we can start to ask our patients to get them to think about this? And if the answer is no, how can they start to invite more joy into their life so they can meet this Ayurvedic criteria of achieving more balance and more bliss? So that's a little overview of this concept of health. Next, I'd like to talk a little bit about the Ayurvedic understanding of dis-ease. So we talked about the word dukkha, which means pain or suffering. So disease is any space in which there is no peace, there is no comfort. And when we start to look at how does disease arise, Ayurveda actually goes into a lot of detail to explain this. So we have a term called samprapti, which means disease pathogenesis. And part of samprapti is we have 6 very distinct stages of this disease pathogenesis. So I'll go through each of these very quickly. But Western medicine only recognizes stage 5 and 6 in the Ayurvedic disease pathogenesis, where we have signs and symptoms and we have disease conditions that start to evolve. So these 6 stages of samprapti, the first stage is called sanchaya or accumulation. And this is where imbalance starts to accumulate, usually we say in the home site. So each of the 3 doshas has a home site in the GI tract. And so within the GI tract, this is where Ayurveda believes is the origin of so much. 80% of illnesses, we say, arises from diet and improper digestion. So we place a lot of emphasis on the GI tract. So sanchaya is when just this imbalance starts to originate, and it's originating contained in a specific location. The next stage of samprapti or pathogenesis is prakopa, where from that localized site, disease starts to spread. Maybe it enters into the tissues, it enters into the circulation, it starts to spread in the body in some way or form. The third stage, prasara, is when that is spreading. So I'm sorry, the second stage, prakopa, is provocation. It's getting more aggravated in that home site. And the third stage, prasara, is where it starts to spread. And this is where it becomes harder as we progress through these stages to contain the disease or the symptoms or to manage it. The fourth stage of pathogenesis we call sthana samshraya, and this is where disease can start to become deposited into the tissues, into arthritis, into the joints, for example. And as that imbalance, which we say is the aggravation of the doshas, as that imbalance has spread and then it becomes deposited into a certain area, we'll use arthritis as a great example. That is when that aggravated dosha is moving into the joints, and that's becoming the area where that disease or condition is going to flourish. The next stage, we say, of the disease prognosis is vyakti, and this is where signs and symptoms actually start to manifest. And this is where in Western medicine, we're very skilled at recognizing signs and symptoms of disease, and this is kind of our entry point into patient management. The last stage, Veda, is differentiation of disease. And so it's really stage 5 and 6, Vyakti and Veda, where we have manifestation of signs and symptoms, differentiation of disease, that is the focus of Western medicine. But Ayurveda says if we can put attention to those prior 4 stages before signs and symptoms actually manifest, this is where we can really work preventively, we can work on longevity, and we can really manage those doshas and manage those body types to be more harmonious so that we can avoid all of this aggravation and try to stem it as soon as possible. So that's a very quick overview of just the disease pathogenesis process in Ayurveda. In Ayurveda school, we get training where we go into each one of these stages in a lot of detail. We look at different disease conditions by following their pathology in all 6 of these stages. And we talk about interventions and things that we can do. You might be asking, how does an Ayurvedic trained person diagnose this before signs and symptoms arise? So the answer to that is pulse diagnosis. This is one of our premier forms of diagnosis before we had technology. All the medical technology and tests that we have now in Western medicine is an amazing accomplishment, but before all of that was created, Ayurvedic doctors relied solely on the pulse to be able to detect doshic imbalances, to be able to detect signs and symptoms. And so the second form of diagnosis, main diagnosis, is tongue diagnosis, where when we stick out the tongue, all of the body's interior organs are mapped out onto the tongue, and based on discolorations, based on the shape of the tongue, based on the movement of the tongue, we can make certain simple diagnoses. A very simple one, you can practice this yourself at home after watching this video. If you stick out your tongue in front of the mirror, if you look at the very tip of your tongue that corresponds to the area of the heart, and if the color of the tip is red or even bright red, you can guess that this person is probably having difficulty sleeping. So a very quick diagnostic check that you can do. And if the patient has the tip of the tongue that's red, you can start to ask them questions about their sleep. Have you been having difficulty sleeping? Depending on how bright red it is, you can see that it's been more chronic or that it's more severe. So that's a wonderful way to be able to just use some simple Ayurvedic diagnosis tools in your practice right away. Pulse diagnosis takes a lot more time to learn, to really have a mentor, to understand all the different pulse positions we're feeling, and that requires just more time and experience and subtlety to start to pick up on the value of pulse diagnosis in your practice. So that's a very quick overview of the Ayurvedic concept of health and disease and how we start to use this in our practice.